my face there.
Okay, we are live with what I would call a special edition of Catalyst Talks. As you know, those of you that have been watching this from the beginning, I'm Joseph Kopser, and I'm joined by David and Beth Hawse, doctors. We've been doing these interviews. They've been multiple guests multiple times, and I've been doing this now since the beginning of March, really, when we started to shut down. Done over 65 interviews, talking to people who are adjusting, pivoting, innovating, doing things differently in the era of COVID to see how we can learn from it. And today, what I learned is that I too have now become a statistic in the COVID era, as I found out that myself and my youngest daughter are tested positive for coronavirus. So I thought, what better thing to do than to bring back onto the show David and Beth Hawse to talk about what's going on, not just with an individual who gets sick, but how the trends are going, what we're looking at. So much to discuss. David and Beth, first of all, how you doing and how are you all feeling?
We're good.
We're good.
Yeah,
we're good.
We feel fine. Still haven't been in a store since March 6th.
Wow. Yeah, I'm tired, but I don't think it's COVID. I think it's just seeing a lot of little kids in the office. I think it's just too much work.
Yeah, in fact, I'm putting in the comment section because people often forget that this is live. And I'd be curious to get other people's questions because the few family members and friends that I've been able to catch on the phone today to A, inform them just for general care and concern, but B, like, oh, by the way, I just saw you last week. You might want to know kind of a deal. So, but they all immediately had a bunch of questions, which is kind of what I want to get into with you all. But before I do that, anything big picture before I go deep into the specific situation that our family experienced, and then use that perhaps as a lesson learned for future families going forward. How do you want to proceed?
I think I'd talk about, I think it would be helpful for you to tell people how you feel, and then we can talk about that and the various different ways people present with COVID, from where Piper is to where you are, to, you know, the other end of the spectrum, because I think it's important not to get the impression, oh, you get COVID and then you do Catalyst Talks. I mean, that's not for a cadre of people. That's what it is.
Right.
But for a cadre of people, they never know they even had it. And for a cadre of people, you know, 20% of people end up in the hospital with it.
So for example, I just heard this on the mainstream media, I guess, whether that's dependable or not. Like in California, I think the 20 to 40-year-olds or 20 to 35-year-olds are 30-some% of the population, but they're 56% of the positive COVID tests. So especially Piper being young and asymptomatic, we're finding a lot more of those people are running around. And that's part of probably why we're having a little bit of an uptick here.
Yeah. Well, so to your point, David, I'll kind of tell you how I'm feeling and how it came to be. And then if there's anybody listening live or they watch it later on replay that can relate to this. So Monday morning, woke up a little slow. Now I attributed that immediately to the day prior was Father's Day. And I will admit, I sat out in the pool and drank my fair share of beer too. And thanks to you, Keaton, who delivered to our house chocolate chip cookies and beer. I had my favorites for the day and had a good time. So I woke up slow Monday morning, but all day Monday felt a little bit weird, like I was losing one step or just wasn't quite in, my normal stride. Went to bed feeling pretty decent. Woke up Tuesday morning with very little energy, so much so to the point that I did a workout, but it was a pathetic little workout because it didn't have any gas in the tanks. And then had some meetings. And then 1 o'clock that afternoon, I had a Catalyst Talks with my good friend Preston James talking about Div Inc. And I'm telling you, Dave and Beth, the second that I hit the end button on that broadcast here, it's as if my body knew that I was done with formal work for the day. And then I just went, whoa. I mean, all the energy was gone. I got chills, had goosebumps all over the place. I felt like I'd just been punched in the gut. And so I just went into the guest room and just said, okay, maybe it could be Corona, but I got 3 other people here in the house. I'm not going to scare anybody. So I'll just go take a nap and see if this was just something else, like a 2-day hangover. No, I immediately fell asleep for like 90 plus minutes, woke up, it was probably running a low-grade fever at that point. And then that's when we reached out to the doctor to try to get a test for the next morning. So Tuesday night, I knew I was out of step bad. Tuesday night, I only drank 2 beers. 2 beers. I had no appetite for beer. And so I knew something was really wrong. And then I went to bed Tuesday night, slept for 11 hours. I haven't slept for 11 hours. I can't even tell you the last time I slept for 11 hours. Got up long enough to take myself to the doctor to get the test. They had a nice little outside clinic with the tent, and she came out looking like something out of E.T. in that last scene in the movie, and administered the test. By the way, they had run out of swabs, so I was already now working with the swish and spit. Got back to the house, did a couple more meetings online, crawled into bed again at 1 and slept for 5 more hours. And then the next morning, when you, Dr. Hawse, David type, called to check on me, I think you called me and it was 8:30 or 8:45 Wednesday morning, and you woke me up. That's when you knew it was coronavirus. So anyway, there's been, head congestion. There's been some other things, some weird coughs. Just like Dr. Fauci said, everybody seems to take this disease in a different way. Mine is just altogether weird in the symptoms and the way they're coming together.
Yeah, I don't know that it's weird.
Yeah.
I think, the thing is, a lot of people, it seems, fatigue is one of the first things. And we always say this about the flu, true influenza is like I got run over by a bus. I was totally fine, and bam, I got hit by a bus. Coronavirus seems to have this, a lot of the physicians and healthcare workers, come home from a shift, they lay down and just can't get up, exhausted. And so exhaustion and fatigue is a big thing. And I think, there's a wide range of this from, as you brought up Piper. And so, from being totally asymptomatic and get caught because you were tested screening, basically, to people that have fatigue and sore throat, allergy type symptoms a lot of times.
I thought it was allergies to begin with. Absolutely thought it was allergies.
Yeah.
Right.
And then we have another friend who had this, who, runs 6 miles 3 or 4 times a week. And, it's my understanding he never ended up in the hospital, but he was to where he couldn't get up out of bed to make it to the bathroom.
Because he was short of breath.
Because he was short of breath and exhausted.
A pneumonia picture. But his wife ended up with it, and she had sort of a headache for one day, and then she had some nasal symptoms that she thought were allergies, and then she lost her sense of taste and smell.
Yeah, which is a big symptom. And the only thing we know that causes you to acutely lose your sense of taste and smell is coronavirus. I mean, if you have that symptom.
But it goes all the way down to their kids who are like middle school and elementary school, who literally had a fever for one day.
Yeah.
One day, one dose of Tylenol, that was it. They were back up to full speed. So it just runs the gamut from totally asymptomatic to pneumonia.
Yeah.
So the thing that I would want to talk about that I think can be helpful to people and be helpful to us as a population is what you and I talked about before you had a positive test, and that you called me, I think initially on Tuesday, and you said you had been fatigued and tired. And at that point I said, a couple of things. Number one,
he's never fatigued and tired. That's changed for you, right?
You should assume that you have COVID, number one. Number two, whether you have a positive test or not, you should still assume that you have COVID, because the issue is that as many as 40% of these tests are falsely negative. And so it's almost a flip of the coin if you have a negative. A positive tells you have it, but a negative does not rule out you having COVID.
You're not in the clear if you're negative.
And so so the instructions that we give people are for people that are symptomatic with COVID. You need to be, you have to quarantine for 10 days from the onset of your symptoms. You have to be at least 72 hours without fever, and your symptoms have to be clearly improving before you ought to come out of quarantine.
Yeah.
And so, the trouble that we have as physicians is getting people to understand I had a negative test, but I still have to act like I have COVID, because they say I don't have it because I had a negative test. And that's dangerous.
Yeah. Well, so let's talk about how it might have happened. So those of you that don't know me personally, I wrote a piece with the help of Michael Brew on February 16th. Think about where we were as a country, February 16th, talking about coronavirus and watching the numbers and studying it. We were still traveling. We went up to Dallas one more time to see the girls, to see Keaton. And it was about that last week of February that I remember seeing the spikes that were occurring in Italy, that portion of Italy that was hit so hard. And that's when I started stocking up on canned food and toilet paper and basically bunkering down. And that's when people were teasing me about overreacting. Now, granted, 2 weeks later, when there was a run on toilet paper and everything else, people were like, oh, I get it.
Did this surprise them? Because was that not your job in the Army?
Well, there is a little bit of that in the Army to be
Was that not like what you did for a living, was to like keep people organized and logistics?
Yes.
Like,
and hot dog people over here, hamburger people over there. It comes in the family tradition as well, thanks to Dad. But what was even more telling is it was also then March 7th, I believe it was, that Mayor Adler made the decision that we needed to think very seriously about South by Southwest. Capital Factory here, it had a big conference. They canceled. And so we in Austin were starting to shut down. Well, we as a family basically just kind of closed the doors and said, that's it. Keeping that discipline, though, was so hard to do. And then after 2 months, we started to let our daughters, 20-somethings in college who had come back home, start to go back out and see their friends. And I'm convinced that's kind of how this is really vectoring around right now, which is it is not necessarily you, the individual, who are staying in, but if you are seeing anyone that is not staying in, again, I know you're going to tell me I told you so, but I'm just referring to the humanity of this, which is how do we manage this? And then, oh, by the way, get those 20-somethings to realize that they can't quite hang out in the crowds they want. And by the way, I don't think our daughters were doing that in large numbers. It's just that the friends and friends of friends.
I heard a good lecture today. It's just a short little lecture by one of the psychiatry professors at Baylor, which in Houston, they're dealing with all this. And she was talking about human nature, and human beings are social, and we're social beings. It's very, very difficult to be out in any sort of, and I don't mean a large group, even talking to like your neighbors, and not be getting closer than 6 to 12 feet. That is just not how our brains are wired. And you have to think, for the 20-year-olds, they're in this developmental stage of independence versus dependence. They have a drive to separate from their parents. It is not.
And by the way, that's a good drive. We don't want them living here forever.
If parented correctly, they should want to get out of your home.
And you should want them gone.
You should want them gone. So we also have a 20-year-old who is now, not happily, I mean, he loves us, but he cannot wait to move into his apartment, which is going to be ready. And he's probably counting the days. I don't know how many days, to be living with his friends again and not with his 50-year-old parents. So, I do get into, I don't want to like shame the 20-year-olds, because it is such a innate subconscious drive to meet new people, to go out and do things. It is against every bit of biology to ask them to do what we're asking them to do.
Well, and I think, going back, masks, masks don't work individually. Masks work collectively. And having 80 or 90% of the population wearing a mask has profound effects on the communicability of this illness. And so if the thing is, people want to go out, and I recognize that. But, if you go out and you're not wearing a mask and other people aren't wearing a mask, or if you're wearing a mask and other people aren't wearing a mask, it's not helpful. And that's one of the things I almost want to put on, like typing on the front of my mask that says, I'm wearing this mask for you. Have the same fucking courtesy for me, please.
Yeah.
A lot.
Well, I'm bringing this map.
I have a big face, though, so I can get like in 3-inch block a lot of stuff on there.
Yeah. So I'm bringing this map back up again and I've had this conversation with friends of all different backgrounds. But one of the things that concerns me through all of this is how, frankly, politicized politicized people are interpreting their medical advice. So to your point about masks, I mean, everywhere I go, I'm wearing the mask. Even one time I forgot my mask, went into a store. First thing I did was went to where they sold masks, grabbed it, ripped it open, put it on, and then basically waved at the cashier to say, like, I will bring this over to pay for it, but just, pardon me. And so it's just interesting how there are some people who don't see who do see the politicization of medical advice.
But part of the problem is that store should not have let you in without a mask. That's the level, and that is the level that we have to get to where no shirt, no shoes, no mask, no service. You cannot go in.
Well, and as I've told some of my patients, say I have a person who comes in with a cut to my office that I need to put stitches in. You, as a parent of a child, because we're pediatricians, you would lose it, I would hope, if I started sewing up this cut and I didn't have any gloves on. Like, you would rightfully be like, what in the hell is going on? Why does she not? Because the gloves are to protect the kid from me, but they're to protect me from the patient too. And so I look at masks the same way. I mean, it's exactly that. I'm protecting you from me and me from you. Yep. So we would never say, oh, this person has HIV. Let's just do open heart surgery barehanded. That's a Republican thing or Democratic thing or whatever. So I look at it the same way. I just think it's insane. I mean, I don't know. It's hard for me to understand. And probably that's because I'm a physician. But like, of all the things you could politicize, I don't understand the mask, except for the poor example being set by our leaders of not wearing a mask.
Yeah, I mean, or another way to think of it is if the doctor has HIV and is going to do surgery on you without gloves.
Would you not like me to wear some gloves?
You should wear gloves. You should wear a mask.
So this gets to the idea of new norms. I'm bringing up the example here of the governor of Texas, who, as you know, we've been in correspondence since your very first appearance on Catalyst Talks months ago at the beginning of this, that states were often, unfortunately, as correlated to their political leanings, interpreting the disease and its scientific background, if you will, differently. So here in the state of Texas, they rather than make it a localized control kind of an issue, they wanted to consolidate all the decisions at the state level. And that's what led to this great opening that occurred at the end of May that I think has been largely attributed to this huge spike that we've had, to the point now where even the governor of Texas has rightly looked at the numbers and gone back and changed it. So my question to you is, will this be a forever seesaw? Or are we going to finally get everybody on the same sheet of music, or what's it going to look like?
It will be a seesaw until we either collectively come together and work together as a team, okay, or there's a vaccine and 80% of people get the vaccine. Yeah. Otherwise, it will continue to bounce around our country. It will come to Kentucky at some point. It'll go back to New York City. It'll go back to everywhere that it's been, and as bad as it's been, it'll be that bad again or worse until we either are collectively wearing masks or we are have a vaccine. And you were talking about Governor Abbott, and I will tread lightly, but which is hard for me, but it always fascinates me, the people that want local control of things until it's against what they politically want, and then they want to control it. And Governor Abbott strikes me as a person who is all into local control of schools and local control of all police departments and local control of all of this stuff. Local control of abortion laws and not from the country. He's trying
to hold it together.
But now over masks, because frankly, the president said, you can wear a mask, but I'm not going to wear a mask. And that's where this all started.
Yeah.
That's where it all started, because he cued a certain percentage of our population to believe that you don't need masks. And so my contention is, at least be consistent. If you're a local control, states' rights, local control person, then let Austin make everyone wear a mask.
Yeah. So it's funny. For those of you that are watching nationally that don't follow Texas politics, that's actually the reversal that happened last week, essentially, when the numbers in densely populated areas really started to take off because our bars, because our restaurants were opening in higher capacity. The mayors wrote a petition. They got together and wrote to the governor. And ironically, the governor's office said, well, we never said you couldn't do that. We never said you could. So it's one of these ridiculous he said, she said kind of a situations. But here's the good news. We have an opportunity now with these numbers to maybe make an impact. But before I do that, I want to thank Derek and Monica and Molly for their kind words in terms of getting well. And I think I'll be just fine, knock on wood. I think I'll be just fine.
I think we're going to talk about that at some point.
Yeah. What I want to talk to you about, though, is just this idea of the seesaw effect and getting everybody to wear masks. What will it take, do you think, and I'm not trying to put you into the head of reading the mind of those that work in Washington or whatnot, for others to finally start to role model the behavior we need?
Someone close to them being really sick. I think that's human nature.
Okay.
I'm with my
Probably.
Psychiatrist friend. We see it a lot with vaccination, right? And anti-vaxxers, nobody believes their child can die of encephalitis from measles. And then some kid does. And then suddenly it's real. And a lot of people don't vaccinate their kids for flu. And, we have 1 or 2 kids die every 4 or 5 years in our practice from nothing but the flu, which is that is preventable. Even if the flu shot, even if you still get the flu, the odds are you're not going to die of the flu. And so we preach it over and over and over, that until you see somebody's previously healthy 6-year-old kid die, it makes it real. And so that's, I think, why you see physicians, we get so, regardless of our political leanings, I think you see physicians and healthcare workers get so concerned about this because a dead person is very real to me. I've told David all the time, this is why you do gross anatomy. It's the very first thing you do when you go to medical school. It is very real. And it's not something that's political. It is sad that it takes that in human nature for people to believe.
Yeah.
But we're not in the pocket of big pharma. It really, I wish I was, but I'm not. If big pharma's out there and wants to hire me, I would like to be in your pocket, but I'm not. And so I'm, still paying off my student loan. We're getting there. But I think that it's just not political. It is very real to us. And if we can help you, keep your family members well, that's why we did this. There's other things we could have done to make money. That I think you'll see that doctors and nurses almost, it's not ever going to be herding cats and be every single one, but the great majority of healthcare workers will tell you that they have a mask on, they socially distance, they clean their home, they do these things that the CDC recommends. Yeah.
So to Jody Mixon's point, she put on there, exactly, everyone act accordingly is the point. South Padre Island here on the Texas Gulf Coast had 67,000 people, while Corpus Christi had 100,000 people at the beach over Memorial Day weekend. And
it appears it's not 2 weeks after these things. It's 3, 4, 5, 6 weeks after these big events where you start seeing these spikes.
And is it because it's bouncing around or it's asymptomatic?
So my suspicion is that what happens is there's a cadre of people who get it, who are asymptomatic, who then pass it around in a community. So like Padre, there probably were not a lot of 60-year-olds tanning at South Padre Island. And if there were, I don't particularly care to go there. And so what happens is you have 20 and 30-year-olds hanging out together who then get and pass amongst themselves, and then they start passing it into their homes and their parents and grandparents.
Middle-aged people get sick, and then we figure.
And this is the problem that's going to happen with schools in the fall. Right. The fact of the matter is, yes, kids can get very sick with this, and we've unfortunately nationally seen some kids die from this, but not at the rate that 80-year-olds. But the thing is, there are a lot of 6 and 7-year-olds who go after school, they go to their grandparents' house.
Oh yeah, we've got a In our neighborhood, yeah, we've got a situation where there are some working parents that don't have a choice. Yeah. There is not a daycare option for them, and they are bringing their young children to their elderly grandparents that live here on our street.
And I'm not saying that there's an easy answer,
right,
for this, but it is my suspicion that 4 to 6 weeks after your kids go back to school, that you will start seeing a increased amount of illness in the community.
Yeah, that's a whole other can of worms. Kentucky released some guidelines this week, and then Fayette County, which is the county that Lexington is in, is trying to start some. But schools have been underfunded and overcrowded for years and years. I'm sure this is true in Texas too. So it's really difficult to socially distance when you're in an overcrowded school to begin with. And then, when you put a mask on a little kid's going to start touching the mask, which is doing more harm than just leaving the mask off. So I thank God every day nobody asked me to be on that committee, because I don't think there's a good answer to that.
Wow. Well, let's go back to another topic. We still have almost 20 people watching. So if you have questions for doctors, Beth and David, or a question for me about my own little small journey in this, please let me know. But David or Beth, if you were, you're not giving me medical advice per se, but if you were to be telling me what to do now that I have been tested positive over the next 2 weeks, 10 days, what should I be doing? What should I not be doing in terms of care, relieving symptoms, and just making sure that I get through this without ending up in an ICU?
Yeah. So the first thing is, I think you have to recognize you're 3 or 4 days into this. Likely you were contagious for 2 or 3 days before you got sick. So, likely you were probably contagious from, you were probably exposed. The incubation, 98% of people will have symptoms if they're going to get symptoms within 14 days, or within 10 days of their exposure. Most people within 4 or 5 days. So likely you're exposed early, in the middle part of last week. You're probably symptomatic through the entire weekend.
And David, let me interrupt you there.
Because contagious through the weekend.
So you talk about symptoms, and Joyce, who just popped on with a question about that, missed the beginning. So for me, and everyone's different, for me, the symptoms were Monday morning feeling like I was, just dragging all day long, loss of appetite, loss of beer appetite. And Joyce, you know what that means to me. And then Tuesday, just absolutely knocked over in terms of fatigue. That evening, I slept for 11 hours. The next day, I slept for 5 hours in the middle of the day. A little bit of cough, a little bit of head congestion, but mostly it was the absolute fatigue. So anyway, that's to bring back people who have just now tuned in, because we've been going a while. But David, so you were talking about once symptoms start showing up.
So you're likely contagious through the weekend. Monday morning, you probably get symptoms. The thing that I would tell you about this is, when you and I spoke on Tuesday and you told me what was going on, I told you likely had COVID. And you said, I think this is allergies, maybe whatever. And I think that the reason I point that out is to say that when you get sick, you're not going to necessarily say, first thing, I have COVID. That's not what's going to come up in your mind. It's going to be, it's my allergies, it's something else. And so there seems like there are two phases of this illness. There's a first phase that's really mediated via the virus itself, which seems to be in the first 7 to 10 days of it. Body aches, congestion, diarrhea, cough, sore throat, fever, all of that portion. The people that are getting really sick are the ones that are they think that this virus is triggering an inflammatory illness, and people get 7 to 10 days into it. And at that point, it's not the virus itself, but it's the inflammation. So the reason I say all this to you is to say you're 3 or 4 days into this. Okay. So you are probably at the peak. I think it's unlikely that you're going to trigger into an inflammatory thing, but I think it's important that we talk about it, because everyone is different. And the big thing that I tell people is, if you're getting to where you're short of breath, if you're getting worse, if you're, you need to seek medical care, not by showing up in your doctor's office without calling them,
Right.
but by calling and saying, I have a positive COVID test. I am now short of breath. The answer to that is they're going to send you to the emergency room.
But I would call them first, because when people call our office, I can tell you, I know which emergency room, how each emergency room is working usually, or can find out, and what the wait is, and that sort of like logistical. If it's not a 911 situation, we usually tell our patients to call us first. And people, and we haven't talked about this whole time, that people, if they don't have a primary care physician, which a lot of people don't, that haven't been on any chronic medications, now's the time to establish that, because you don't want to be going to the ER or an urgent care where you're going to see a different person every single time. If there's a person like David knows you, Joseph, when you tell him you sleep 11 hours, he's like, you have COVID. And that's the purpose of, people ask me in our practice, why do my kids need all these checkups? My kids are fine. I said, so I know what you look like when you're well. So when you're sick, I can tell this is not you. This is not this kid's personality, to hopefully catch things earlier. So now is the time to find a primary care doctor. If you don't have one, it'll make your life a lot easier, and let them figure out where to send you and all those logistics.
So, but as far as going forward for you, let's presume that you have a relatively mild illness. Okay. You are still contagious. If this started Monday, you're contagious until a week from yesterday. So next Thursday. All right.
Yeah,
you should be in quarantine. And quarantine is not like just hanging out in your house on the couch watching movies with your kids. Quarantine is in your room by yourself, people throwing food in, like Feed the Lions. All right. If it's not 120 outside, opening your windows. There seems to be, the air conditioner moving viral particles through houses. And that's how multiple people in a house get sick. And so, opening windows if you can. Our friend, they had a little room over the garage that he stayed in. And so, but certainly not interacting with people outside of your home until next Thursday.
But let's be pragmatic. You're talking about a household of 4 people and 2 puppies.
Yeah.
Because the daughter brought a puppy with her. Yeah. One is already tested positive. My daughter, Amy and Hadley went this morning to get tested. If we all 4 end up in a positive test case scenario, we could perhaps have free movement around the house, right? Instead of me holed up in these 2 rooms.
Yeah. And then at that point, you're 10 days, you're all quarantined for 10 days from the last positive test that someone had.
Okay, wait, that's very important. Let me make sure I said that. We go 10 days past the point where the last person tested positive.
Right. So the CDC recommendation, and this is all on their website, it's different if you're symptomatic versus asymptomatic. So symptomatic person, so for you need to be 72 hours with no fever, 72 hours respiratory symptoms improving, and 10 days from your positive test.
Got it. Okay.
Or now, 10 days from your positive test.
Now with
but
Piper,
the asymptomatics have to be 10 days from their positive test. And ideally, if you have easy access to testing, get 2 negative tests 24 hours apart.
So in asymptomatic people, there are a couple tricks with asymptomatic people. Number one, there is some evidence.
By the way, for those that are listening in, I just want to remind everyone, asymptomatic means it doesn't look like and they don't feel sick.
Correct.
Yeah. Got it. Keep going.
And so you take Piper, who is asymptomatic at this point. There are 2 issues with that. Number one, those people, if they do get antibodies and make antibodies, it doesn't appear that their antibodies are as long as lasting as people who get clinically ill. Number 2, it has been shown that asymptomatic people can shed the virus for 3 or 4 weeks. Now, we don't know that they're still contagious 3 or 4 weeks out. And so that's why the recommendation is in 3 or 4 weeks of quarantine. But if you take your Piper's grandparents that just moved to Austin, all right, they are. I'm sure Pat is, 45. Alan is 103.
And if you're watching, Pat or Alan, make sure to correct those if we got them
the way they look. I mean, Pat looks like she's 45 and Alan
Right.
looks like he's 105. But the point being is Piper needs to be particularly concerned about being around them. And you all need to be particularly concerned about being around them.
Right.
And so before I let Piper see Alan or Pat, I would make her get 10 days. I would make her get tested. If it's negative, I would get another test. All right. And then if it's negative, I would consider letting her being around Alan and Pat.
And then for Amy and Hadley, it's different. If they test negative, they need to be away from Alan and Pat for 14 days past their last exposure to you and to Piper. So actually for the people in the house that don't get it, their quarantine is longer than for the people who do get it, which is kind of backward thinking, but it's because it can take anywhere from 1 to 14 days for it to appear. So you don't have to remember all this. If you look at the cdc.gov and push coronavirus, it's all on there, what you need to do. And it will change. Like that 10 days used to be 7 days. And as this goes along, we learn more, and we learn like the 10 days is a little bit safer than the 7 days. So that may change. So I just caution you every couple of days to check that. So what to do if you're sick, that's what you click on, and then it'll tell you what you should do. It'll tell you how that the surfaces need to be cleaned in your home. It'll go through all this that I just went through.
Yeah. And by the way, to Sherry Caceres and Adam Carriero just tuning in, thanks for your kind words. Yeah. So, I mean, it's all here, but since we have attention spans that last less than a commercial break on American Idol, I hope that not only those in our household will take it seriously, but everybody else as well. So we'll end up answering a question that was asked earlier by Lay, which is just this idea of no kidding, what happens if we don't do this? We don't get this right. And let's talk policy, because you talked about a worst case scenario earlier with respect to education, but healthcare itself, universal coverage, whatever we want to call it or refer to it. What does it need to look like so that we can get ahead of this if we live in this continuous cycle of up and down response to the coronavirus around the planet?
So the inherent problem with the United States medical system is that physicians are paid mostly to fix problems as opposed to prevent problems. And so, so what happens is, I tell people this all the time. We have universal care. We just have the most inefficient and expensive universal care you can have. Because what happens is, let's say somebody goes to the mall and they have a heart attack and they're on the ground. We all agree we're going to call 911 and send them to the ER. When they get to the ER is legally responsible to take care of that person. Okay. Yep. Despite
and then the taxpayer ends up paying for it. So we are paying for universal health care.
Not only does the taxpayer, but your personal insurance rates are higher because the hospital has to defray that person who's not going to pay onto your bill. So that's why it costs $5,000 for a Band-Aid. All right.
Yep.
And so ultimately what has to happen is we need to agree as a group, as a country, that, that person who had a heart attack, maybe they had a heart attack because they have diabetes and we're not taking their glyburide, which is like $10 a year in medicine that could prevent that heart attack. And so we pay $100,000 to deal with their heart attack as opposed to the $10 or $100 a year it is for their glyburide. And so it's inefficient. And so the point of all of this, and the reason I bring this up is public, I have a libertarian streak in me, okay? And I generally believe that your rights end where my rights begin. And your right to not wear a mask is outweighed by my right to be in public and breathe clean air. Your right to smoke a cigarette in a restaurant is outweighed by my right to breathe clean air. Okay. Your right to love whoever you want to love outweighs my right to be offended by that.
Right.
Okay.
Right.
And so the point is that we have to institute public policy in preventative care. And we have to invest in teachers in schools. And we have to invest in health departments, tracking and tracing not only this, but other diseases and intervening. Everyone got on Bloomberg about decreasing the size of Cokes that you can sell in New York City. Well, it's a public health issue. It's not just about that person. It's about the cost to the system.
Yeah. Well, I couldn't have said it better in the sense that, especially when I was out on the campaign trail, people would ask that question about universal health care. I said, we already have it. It's just so inefficiently delivered right now. And unfortunately, COVID is merely exposing systematic problems we had in healthcare. And by the way, because the disproportionate number of poor and people of color that are succumbing to COVID, it's because, as I understand, their morbidity, is that the right word?
Yes.
Yes.
Is higher because, go back to Exhibit A, you just said about preventative care. They're getting sicker for other reasons that are preventable. And then something like COVID exposes it and then just makes it all work.
And what needs to be done is not, a vaccine is much more technologically based, but what needs to be done to control it now is really not a lot different than what needed to be done in 1918. But we need, you do need to be able to test and to trace. And we don't have the manpower to test and trace, yet we have lots of people out of work. And so it just shows you we do not have organization at the top. And I'm not saying that politically. I'm just saying it's not there. And we can argue about why it's not there or how to fix it. But we do not have organization of this is how it works for like sending kids back to school. I have not seen any large studies of just the background rate of COVID positivity in kids from kindergarten to 12th grade. If we did large studies with like 10,000 kids and we found they were only 0.1% of them were positive, well, then we can go back to school. If the rate is 5-10%, then we're going to really have to think about how we're going to do that. But we lack the basic data to make any decisions. And that is too big of a problem to be done at the local level.
Yeah. I think the one other thing that I will just say, and unfortunately this message has not been passed out. It is your patriotic duty as an American, if we want to make it through this, to decrease your contacts by 80%. All right. Every day, think of the things that you can get away not doing. All right. We've not been in a grocery store for 3 months because we order it via Kroger
But I'm in small rooms with 6 kids 40 times a day, every day. So I've had plenty of contacts. Yeah. I don't need to be going to the store also.
So minimizing your exposures where you can. And then when you must have an exposure, wear a mask and insist that the people around you do the same.
Yeah. Well, that's a nice note to end on. And for people that do find it to be controversial, maybe if they put an American flag on their mask, that would be their way to show.
I have to say one more thing about the patriotism and mask. My grandfather sat in a foxhole in the Ardennes forest. I'm not asking you to do that. I'm asking you to put a piece of t-shirt material over your face. If you can't do that, I'm sorry, you're not a patriot. Take your flag down off your house and your stickers off your car. Because I'm not asking you to sit in a foxhole. It's not that hard. Wash your hands, put a mask on your face.
There you go. And on that note, I'm going to heed as much of all of your advice as I can. This video will stay evergreen on Facebook and YouTube as a part of the Catalyst Talk series. And I can assure you I'm going to rest and lay low even more so than I already have done, which just for those in my circle that know how much I've been trying to be diligent about this, I don't think they're giggling. They're certainly not giggling. But if anything, it maybe ought to be a wake-up call that if somebody as diligent as I was got sick, holy cow, we are all at risk because it was hard to be more diligent than I've been doing. So anyway, thanks for being a part of this. Adam Carrier, let's say, he says in Florida, we need leadership. Yeah. Well, we kind of need leadership in a lot of places right now. So anyway, thanks, Beth and David, for being a part of this. And I'll definitely be in touch.
Feel better soon.
I hope so. Y'all take care.
Bye.